the patient post SABG. Now what SABG we mean, it's a secondary alveolar bone grafting. Just bite a little bit. Okay, now this is him. He happens to be an old patient of Dr. Richardson with a bilateral cleft lip, alveolus and palate. The lip and palate were treated when he was small in his childhood. He would not probably remember, but the problem which he was facing if you see the pre-operative, this is him in January. He was operated about 1.5 months back, where we see the two pre-alveolar fissulas very predominantly present. And also there was lack of bone on both the sides because he had wide alveolar clefting. We are yet to take a scan for him. We will also show the same to you. This is how the healing is. The fistula closure, the bone grafting all healed very well. We still see some suture remnants that we will remove today. It was iliac crestal graft which was taken. That's the best autologous graft that we get, both in terms of cancellous and cortical bone. The site of iliac crest harvesting, which is generally the left or the right hip, in this patient the left hip which has been harvested from iliac crest, it's healed well. He has no walk or gait difficulty, and we'll also see a scan to see how he is. Yes, just lose a little bit. Yes, you can close your mouth. He previously had problems of water intake and coming through the nose. Just ask how he is now.
First
sometimes through this also. This time.
No.
Now fine. How is the pain with the rib? The iliac crest.
No.
Some pain here you feel little bit tender? No, nothing at all. Okay, so he is quite a brave boy to give all answers in like positive affirmations for us, but all negative replies from his side. But the healing has been smooth in his case. He is of 13 years. The mother is concerned about teeth eruption or dental sequencing, as we see a lot of teeth are missing, or the narrow thing which we see is because of probably the tooth preparation, which we say that the crown has been cut priorly done elsewhere. Right now what we are waiting is a prolonged period of waiting or is needed for him to see as to how the graft is taken up in the secondary side, in the recipient side. Once it heals, it's reflected well. If the dental sequencing goes fine, he'll have his permanent teeth in place. Cleft patients, because of the narrow maxillary arch, permanent teeth could be palatally placed, could be impacted or unerupted in certain cases. Accordingly, the dental part will be looked after in the following months post his complete recovery. Thank you.